welcome to Medical Dialogues. I'm Mr. Zaman and today I'm going to talk about pregnant people who deliver large babies are at increased risk of developing diabetes later in life. Find study. Studies show that diabetes in pregnancy, also known as gestational diabetes, puts a pregnant person at greater risk of developing type 2 diabetes later in life. Gestational diabetes is also a common cause of babies who are large for gestational age or LGA. LGA babies are more likely to be admitted to the neonatal intensive care unit and develop health complications later in life, including obesity and type 2 diabetes themselves. In a new study, researchers will unveil findings that suggest pregnant people who do not have diabetes but deliver a large for gestational age baby are at increased risk of developing prediabetes or type 2 diabetes 10 to 14 years later. Researchers used data from the Hyperglycemia and Adverse Pregnancy Outcomes or HAPO follow-up study. The follow-up study looked at the association between gestational diabetes and the long-term health outcomes of pregnant people and their children. Among the 4,025 individuals who did not have gestational diabetes, 13% had an LGA infant, 8% had a small for gestational age infant, and 79% had an average for gestational age or normally grown infant. Data revealed that 10 to 14 years after giving birth, 20% were diagnosed with prediabetes or diabetes, and that the frequency of prediabetes or diabetes was higher among people who had an LGA birth, that is 24.8%, compared to those who had an SGA birth, 15.4%, or even more importantly, those who had an AGA birth, that is 19.7%. The increased risk of diabetes and prediabetes with the LGA infant was the case even after researchers adjusted for risk factors for developing type 2 diabetes such as age, obesity, high BP, and family history of diabetes. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.